Next presentation will be about the autacoids that are derived from phospholipids, and these are known as icosanoids. So the icosanoids are also known as phospholipid-derived mediators. For the outline, this presentation will talk about the introduction to icosanoids. We will also have an introduction to arachidonic acid, the nomenclature of the icosanoids, its biosynthesis, the receptors of the prostanoids, its pharmacologic effects, the therapeutic effects or the therapeutic uses of the prostaglandin analogs, as well as the precautions in using the prostaglandin products, particularly the PGF2-alpha. So what are icosanoids? Icosanoids are a large group of autacoids with potent effects on virtually every tissue in the body. So they are also defined as signaling molecules derived from the oxidation of arachidonic acid, AA, and other polyunsaturated fatty acids or PUFAs. The icosanoids play a key role in inflammatory, cardiovascular, and reproductive functions. They are also referred to as local hormones. They have specific effects on target cells close to their site of formation, and they are also degraded rapidly, so they are not transported to distal sites within the body. The icosanoids are derived from arachidonic acid. When we say arachidonic acid, this refers to a 20-carbon essential fatty acid with 4 double bonds. This arachidonic acid, or AA, is considered to be the primary substrate for the formation of the icosanoids. The arachidonic acid is also known as 5,8,11,14-icosanoic acid. The numbers here, the 5, 8, 11, and 14 refers to the location of the double bonds of the arachidonic acid. Again, there are 4 double bonds for arachidonic acid. The icosanoids include the prostaglandins or the PGs. We also have the thromboxanes and the leukotrienes. All mammalian cells except RBCs produce prostaglandins and their related compounds, the prostacyclins, thromboxanes, and leukotrienes, which are known collectively as icosanoids. For the nomenclature and structure of the icosanoids, the word icosanoid is derived from the Greek word eikosai, meaning 20. So this is because the chemical structure of the icosanoids contain 20 carbon atoms. The name prostaglandin is a misnomer. It was originally thought that the origin of the smooth muscle stimulating and blood pressure lowering substance in human seminal fluid was the prostate, hence the name prostaglandin for this substance. Many years later, the substance was shown to originate from the seminal vesicles, but the name prostaglandin remained. The seminal vesicle synthesizes very large amounts of prostaglandins. The prostaglandin nomenclature identifies 10 specific molecular groups which are designated by the letters A through J. Each group is characterized by the substituent attached to position 9 and 11 of the cyclopentane ring as shown in the next slide. To enumerate the 10 specific molecular groups of prostaglandins, we have this diagram. So in the approved nomenclature, each prostaglandin is named using the prefix PG followed by a letter A to K, depending on the nature and position of the substituents on the ring. So we have here the PGA, B, C, D, E, F to alpha, PGG, and PGH, PGI, PGJ to PGK. So these are the 10 specific molecular groups of prostaglandins. Prostaglandins can be synthesized from three fatty acids: dihomogamma linoleic acid, arachidonic acid, and icosapentaenoic acid, having 3, 4, and 5 double bonds, which can lead to the synthesis of prostaglandin E1, E2, and E3 respectively. The subscript numbers 1, 2, and 3 denote the number of double bonds in the aliphatic side chains attached to the cyclopentane ring. For the PGF series of the prostaglandins, the subscript alpha or beta refers to the configuration of the hydroxyl group at the carbon 9. So one of the prostaglandins that can be derived from arachidonic acid in this figure is the PGF series, particularly the PGF2 alpha. So aside from this, we also have the PGI series, the PGI2. We also have the PGE2 and the PGD2. The first step in the formation of the icosanoid is the release of a 20-carbon polyunsaturated fatty acid, arachidonic acid, from the cell membrane phospholipid by the action of the enzyme phospholipase A2. The stimuli for the activation of this enzyme are either physiological or pathological, including tissue injury, thrombin formation, antigen-antibody reaction, and others. So we have here the diagram showing the first step in the formation of the prostaglandins or the icosanoids. So we have here the role of the enzyme phospholipase A2, which is released from the body in response to physical, chemical, hormonal, and neurotransmitter stimuli. The arachidonic acid is released from the membrane phospholipids by way of the action or by the activation of the enzyme phospholipase A2. We also have this diagram shows the mechanism whereby arachidonic acid is released from the membrane phospholipids, as well as the succeeding events that lead to the formation of the icosanoids. Icosanoids are not stored within cells, and they are synthesized as needed when their biosynthesis is activated by thromba or cytokines, which activate the phospholipase A2. The fatty acids that are cleaved by phospholipase A2 from the cell membrane are then oxygenated by one of the three different families of enzymes to produce the icosanoids. All mammalian icosanoids derive from a common precursor, the arachidonic acid, which is converted into icosanoids with different functions through either the cyclooxygenase pathway, producing prostanoids. So when we say prostanoids, this refers to the prostaglandins, the prostacyclin, and the thromboxane. We also have another pathway is the LOX or the lipoxygenase pathway, which produces the leukotrienes and the lipoxenes. Another pathway is the cytochrome P450 epoxygenase pathway, which produces the epoxy-icosatrienoic acids or the EATs. The figure shows the mechanism whereby arachidonic acid is formed from the membrane phospholipids and the subsequent formation of the icosanoids. In response to tissue injury, the inflammatory cascade begins with the formation of arachidonic acid from the membrane phospholipids via the phospholipase activity. From the arachidonic acid, cyclooxygenase. As shown here, we have here the cyclooxygenase 1 and 2 catalyze two steps in the formation of the eicosanoids, in this case, the prostaglandins. These prostaglandins have four distinct groups: the PGE series, the PGF series, the thromboxanes or the PGA series, and the prostacyclins, i.e. the PGI series. PGE2 is considered to be the primary prostaglandin produced at the sites of inflammation, which both contributes to and modulates the inflammatory response involving pain, fever, vasodilation, and edema formation. There are two distinct types of cyclooxygenases, or isoforms, are known as cyclooxygenase 1 and cyclooxygenase 2. They are considered to be similar in structure, sharing about 60% homology. They differ with respect to the preferred substrates and end products. The cyclooxygenase 1 is the constitutive form of the cyclooxygenase. It is basally expressed throughout the body and catalyzes the synthesis of prostaglandin involved in homeostatic functions, as shown in this figure. The cyclooxygenase is primarily expressed in the stomach, kidneys, female reproductive tract, platelets, lungs, small intestine, cecum, and colon. It is responsible for producing E-series prostaglandin and prostacyclin, which are critical in protecting and maintaining the integrity of the gastric mucosa. Prostaglandin produced by the cyclooxygenase 1 in the kidneys causes vasodilation, helping maintain blood flow, prevent ischemia, and maintain glomerular filtration rate during hypotension. The cyclooxygenase 1 is also responsible for the synthesis of thromboxanes. Thromboxane is a potent inducer of platelet aggregation. The cyclooxygenase 1 is also known as the prostaglandin H synthase 1 enzyme. We also have the cyclooxygenase 2. The cyclooxygenase 2 is the inducible isoform of the cyclooxygenase. It is found primarily at sites of inflammation. This isoform is also constitutively expressed in the kidneys and the CNS. The cyclooxygenase 2 also has important roles in many phases of reproduction, as well as in parturition. The major role of the cyclooxygenase 2 is to aid in producing PGE, which is known to be important in modulating inflammation, and a multitude of pro-inflammatory cytokines, growth factors, carcinogens, and oncogens can induce the COX2 activity. Numerous cell types can also express cyclooxygenase 2 in response to mitogens, including endothelial cells, smooth muscle cells, chondrocytes, fibroblasts, and monocytes. So this diagram shows the role of the cyclooxygenase 2 in the formation of inflammatory mediators, including the prostaglandins, especially the PGE2. We also have the proteases and other inflammatory mediators that are very important in the inflammation process, the formation of swelling, as well as the pain during the inflammatory response. The other name of the cyclooxygenase 2 is the prostaglandin H synthase 2. The diagram shows an overview of the arachidonic acid metabolism pathway. There are three major phospholipase enzymes that are responsible for releasing AA from membrane-bound phospholipids. These are PLA2 or the phospholipase A2, phospholipase C, and the phospholipase D. The cyclooxygenases metabolize arachidonic acid to form prostanoids, prostacyclin, and thromboxane. So this is the first pathway whereby icosanoids now can be formed from arachidonic acid. Aside from that, we also have the lipoxygenase pathway or the LOX pathway. The enzyme lipoxygenases metabolize AA to leukotrienes and the HETEs. The third is the cytochrome P450 pathway, and the enzyme responsible for the conversion of the arachidonic acid is the P450 epoxygenases. It metabolizes the arachidonic acid to mid-chain HETE as well as the 4-EET isomers. This diagram shows the cyclooxygenase pathway. Arachidonic acid is converted by cyclooxygenase 1 or cyclooxygenase 2 to an unstable intermediate prostaglandin H2, which is converted to different biologically active prostanoids depending on the presence of the different tissue-specific isomerases. So when we say prostanoids, this refers to our prostaglandins, prostaglandin F2 alpha, prostaglandin E2, prostacyclin, and thromboxane as shown in this figure. So some of the tissues in which prostanoids exert their most significant effects are also listed. So for example, prostacyclin, it can be synthesized from the endothelium. It can also exert its most significant effect in this tissue. Endothelium, kidney, and the brain. For the thromboxane, it exerts its most significant effect on the platelets, macrophages, kidneys, and the smooth muscle. For the prostaglandin E2, in the brain, kidney, the smooth muscle, and for the prostaglandin F2 alpha, it exerts its effect on the brain, the kidney, and the smooth muscle, to name a few. This diagram shows the biosynthesis and the main biological activities of the prostanoid mediators. So starting with our membrane phospholipids, in the presence of an appropriate stimuli, the enzyme phospholipase A2 will be activated and it will act on the membrane phospholipids to release the arachidonic acid. The arachidonic acid will be acted upon by the cyclooxygenases, cyclooxygenase 1 and 2, and it will form the cyclic endoperoxides. The cyclic endoperoxide PGH2 will be acted upon by tissue-specific synthases to form the prostanoids. Particularly in this figure, we have the prostacyclin, PGI2, thromboxane, PGD2, PGE2, and the PGF2 alpha. These are the main biological activities of prostacyclin. So for example, it will mediate vasodilation, inhibit platelet aggregation, and inflammation, to name a few. For thromboxane, it is important to aggregate platelets as well as it is a vasoconstrictor. For the PGE2, this is important for inflammation, GI protection or the gastrointestinal tract protection, as well as in the regulation of the body temperature, as well as in the kidney because it promotes renal homeostasis. For the PGF2 alpha, its main biological activities are concerned with the reproduction as well as in vasoconstriction. So this diagram shows the production of and actions of prostaglandins and thromboxane. So among the highlights of this diagram include the conversion of arachidonic acid to prostaglandin G2. The prostaglandin G2 will be converted to prostaglandin H2 through the prostaglandin GH synthase 1 or the cyclooxygenase 1. The prostaglandin H2 will be acted upon by tissue-specific isomerases to produce the prostanoids, prostacyclin, thromboxane A2, prostaglandin D2, prostaglandin E2, and F2 alpha. We also have here the presence of the receptors, whereby the prostanoids will act upon in order to produce this biological activity. The receptors of the prostaglandins are said to be G protein coupled receptors. And we also have here some of the tissues wherein these individual prostanoids will exert its prominent effects. So for example, prostacyclin will act on this particular receptor, IP receptor, in order to produce its biological effects on these tissues, endothelium, kidney, platelets, and the brain. We also have here the thromboxane A2 will act on these receptors to produce its biological activity on these particular tissues, and so on and so forth. We will now proceed to the pharmacological effects of prostaglandins. For the blood vessels, PGE2 and the prostacyclin relax the arteriolar smooth muscle and promote vasodilatation. Meanwhile, thromboxane and PGF2 alpha are vasoconstrictors, and thromboxane being the most potent vasoconstrictor. Thromboxane also promotes platelet adhesion and aggregation. On the gut, the PGE2 and the PGF2 alpha contract the longitudinal smooth muscle, and the prostacyclin and the PGF2 alpha contract the circular smooth muscle, but PGE2 relaxes the circular smooth muscle. We also have the bronchioles. On the bronchiolar smooth muscle, the PGE1, PGE2, and the prostacyclin relax the respiratory smooth muscle, whereas the thromboxane and the PGF2 alpha causes contraction. For the platelets, prostacyclin inhibits aggregation, whereas thromboxane is synthesized by the platelets and strongly promotes aggregation. This diagram shows the signal transduction mechanisms responsible for mediating the effects of prostacyclin and thromboxane. The one in green is the prostacyclin, the one in red is the thromboxane. Collectively, they are called as prostanoids. They are derived from arachidonic acid. The prostacyclin is mainly produced by the endothelial cells, while the platelets is mainly produced by thromboxane is mainly produced by the platelets. The prostacyclin can act on the IP receptors of the platelet and the vascular smooth muscles. So it can decrease, so when it will bind to the GPCR receptor containing particularly the IP receptor, it will result in the decrease in the calcium ion, intracellular calcium ion, resulting in vasodilation and decrease in the platelet aggregation. In contrast, thromboxane will stimulate the thromboxane receptors to produce an increase in the intracellular calcium, resulting in vasoconstriction in the smooth muscle and increased release of the granules and aggregation in platelets. The thromboxane can also induce changes in the shape of the platelet that will contribute to the increases of platelet aggregation by effects on the particular enzyme. So the thromboxane will ultimately lead to the formation of a thrombosis. So as you can notice here, they have contrasting effects on the vascular smooth muscle and the platelets. So on the vascular smooth muscle, prostacyclin will induce vasodilation, while thromboxane will induce vasoconstriction. On the platelets, prostacyclin has a decreased platelet aggregation, so it will decrease the aggregation of the platelets, while for the thromboxane, it will promote the platelet aggregation. Another pharmacological effects of prostaglandin is exhibited on the female reproductive tract. So the PGF2 alpha is the luteolytic hormone produced by the ovaries and the endometrium, which causes the ovulation and regression of the corpus luteum. So the technical term for the regression of the corpus luteum is the luteolysis in cycling animals. So the corpus luteum can be found in the ovary. So in the prepartum period, the PGF2 alpha initiates luteolysis, which decreases the plasma progesterone levels. We also have the PGF2 alpha is also a stimulant of the myometrium and is involved in the parturition. PGF2 alpha induced luteolysis and myometrial contractions are used therapeutically to control reproduction. For the central nervous system and the peripheral nervous system, the prostaglandins, particularly the PGE series, prostaglandin of the E series, PEG1, PGE1, or the PGE2, when it is administered into the cerebral ventricles, it will increase the body temperatures. Pyrogen initiates the release of interleukin-1, which promotes the formation of PGE2 prostaglandin. So when we say pyrogen, these are substances that can produce fever. The neuroendocrine function, the prostaglandins, particularly the PGEs, can enhance the secretion of the anterior pituitary hormones. So when we say anterior pituitary hormones, these examples of this are growth hormone, prolactin, thyroid-stimulating hormone, to name a few. And this can be done by activating the AP1 and the AP4 receptors. Let's now proceed to the therapeutic uses of prostaglandins. It should be noted that only the PGE and PGF2 alpha analogs are used therapeutically in veterinary medicine. The first prostaglandin analog in veterinary medicine is mesoprostol. Mesoprostol is a PGE1 analog that has two functions which make it a useful protective agent for the GI tract. It directly inhibits gastric acid secretion by parietal cells, and it facilitates PGE-mediated mucosal defenses and healing in response to GI injuries. Mesoprostol is used to treat gastric ulceration when caused or aggravated by non-steroidal anti-inflammatory drugs. Mesoprostol can cause diarrhea, bloat, colic, and abortion. We also have the dinoprost. Dinoprost is a naturally occurring prostaglandin F2 alpha. Its commercial preparation is the drug Lutelyse, available as Lutelyse injection in 5 mg dinoprost per ml. So Lutelyse is the trade name of the dinoprost. The dinoprost tromethamine is the salt of the dinoprost. So as indicated in the label, Lutelyse injection is indicated as a luteolytic agent. So when we say luteolytic agent, that is a substance or that is a medication that will regress the corpus luteum. Corpus luteum is responsible for the maintenance of pregnancy and the production of the hormone progesterone. Luteinized injection is effective only in those cattle having corpus luteum, i.e. those which ovulated at least 5 days prior to treatment. So luteolize is also used for estrus synchronization in beef cows, beef heifers, and replacement dairy heifers. It is also used for silent estrus in lactating dairy cows with a corpus luteum, for the treatment of pyometra in cattle, and for abortion in beef cows, beef heifers, and replacement dairy heifers. For swine, luteolize is used for parturition induction, and for mares, it is used for controlling the timing of estrus in estrus cycling mares. We also have another is the cloprostenol. Cloprostenol is a synthetic prostaglandin analog structurally related to prostaglandin F2 alpha. So while dinoprost is considered to be a naturally occurring prostaglandin F2 alpha analog, the cloprostenol is a synthetic version. Cloprostenol has been used in cattle to induce luteolysis to manipulate the timing of the estrus cycle to benefit breeding management practices. It can also be used to terminate pregnancy resulting from undesired mating and to treat conditions associated with prolonged luteal function such as pyometra and luteal cysts. So this diagram here represents the cloprostenol injection available commercially as in the trade name Pregova, that is manufactured by the company Verba. So according to the label, the Pregova injection helps in the treatment of reproductive disorders like subestrus, pyometra, luteal cyst, and synchronization of estrus. In terms of its description, the Pregova injection is a synthetic prostaglandin analog of PGF2 alpha for use in cattle. For its administration, so it is administered at a dose of 2 ml per animal intramuscularly. You also have the precautions to the use of the PGF2 alpha drugs. So among these are animals with respiratory or GI disorders may be compromised by the bronchoconstriction and the stimulation of the GI motility by the PGF2 alpha compounds. We also have the older animals may exhibit exacerbated vasoconstriction associated complications. Women of childbearing age or who are pregnant, persons with asthma or respiratory disease should use these drugs with extreme caution as they are readily absorbed via the skin.